for Pet Perspectives, sponsored by Ada Animal Hospital. February, it's Pet Dental Health Month, and getting our pets' teeth regularly cleaned is very important, but it's often overlooked. So we have right now with us Dr. Jenny Norman and, of course, our mascot, Rocco, who's donning his Valentine's t-shirt.
He's ready for the holiday.
Yes,
he's all love.
He's got the Care Bear on there with the heart, and then I love, what does the shirt say, Dr. Norman?
It says, "Food is my Valentine."
Oh, that is so true.
It's so true for him. That is his love language, treats and snacks.
Absolutely. All right, so today, though, we're talking about dental health for our pets.
Yes.
You know, we make a point to brush our teeth, hopefully at least twice a day.
At least, yes, we would hope.
Yes, we would hope, because we know how important it is for us to have great oral health. But that's also something that's incredibly important for our pets.
It is, and it's often one of the things that it gets overlooked. And by about 3 years old, about 80% of our dogs have some level of dental disease already.
Oh, 3 years?
By 3 years, yep. So young.
It's
young. You know, it's not just this old dog, oh, you know, their teeth are so bad because they've reached 17, 18 years old. No, it's our young pets that we're starting to see that buildup in dental disease on.
Oh my goodness.
Because we're not getting in and brushing their teeth. So that's, I mean, my big point for the day, the best thing you can do for your pets is brush their teeth.
Okay, what about those that go, oh, you know, I have a very active chewer. I have a pet, she's constantly chewing on some kind of resin bone, you know, and they feel that that is a dog's way of cleaning their teeth, right? Because I mean, I think that's the old adage that we're always told.
It is.
They chew because that's how they keep their teeth clean. So they're brushing their teeth already. But help pull back the veil on that.
And it's not 100% true. You know, chewing, that motion, it does break down some of that buildup on the teeth, but not the level of brushing, and not always. We can get other issues with that. Those hard antlers or marrow bones that a lot of times we think are brushing their teeth can then lead to broken teeth. So then you have a broken tooth that can become infected, which is a whole nother level of dental disease and dental issues in our pets.
Absolutely.
So, you know, one of the best things what we can do really is we've brought these animals into our home, they're part of our family, brushing their teeth and giving them things that are going to be safe for them to chew that can still be helpful, can all be a part of their dental care at home.
Okay, so what do we do at home in addition to making sure that we're not giving them something that's going to damage their teeth when they're chewing?
Yes. So I'll harp on it one more time. Brush their teeth.
How do you brush your pet's teeth, though, Dr. Norman?
So you brush their teeth just like you would, you know, yourself. Kind of work on getting that motion in. Practice with it. Don't go and shove that toothbrush in abruptly.
Okay.
Let them work at it. You know, let them sniff it. Put a little treat on it for the first week. Let them just get used to it and lick it. And then slowly work up and do that same mechanical motion that you would do.
Okay.
But in addition to that, avoiding those really, really heavy things like those hard marrow bones, antlers that they can break their teeth on, but looking for alternatives. Dogs especially, they're chewers, they want to chew. So I understand we need to give them something that can help.
Yes. And then what do you brush their teeth with?
So there is dogs and cat specific toothpaste out there. It can be flavored, makes it a nice treat for them. There's a lot of different dog and cat toothbrushes. Some you can put on your finger and get in and brush, or even just a normal human little toddler or baby toothbrush is perfectly fine. Their teeth in that sense, pretty similar to ours.
Okay. And when we're brushing our teeth, or not our teeth, sorry, when we're brushing our pet's teeth, we want to make sure that we focus on the back just like we would as a human,
Exactly,
right?
Exactly. So if Rocca will let me model with my finger here, you want to go in and just really kind of gently brush back and forth on the outside there. I know.
He's like, okay, I'm done. Thanks, Mom.
I know. I forgot your toothbrush with your little treat on it, but we'll give you. There, you did so good.
Oh, okay. And so even something as quick as that could make a difference.
It's going to be better than nothing. Exactly.
Okay.
Yep. Just making sure you're getting in, especially if you start that when they're young and get them used to it. You're not going to have to be brushing off these thick layers. You're getting that layer off just like we do when we brush our teeth at night.
And what if we feel that, or what if we are doing our best to do that, but still it's not enough? Are there foods, are there certain treats that also kind of help?
There are, because sometimes it isn't, especially if you have a small dog, they're prone to dental disease, and so they often need more than just that. And so there's different products out there. There's water additives that you can mix in their drinking water to help break down plaque. There's different treats and bones that can be helpful. There's a lot of different dental healthy diets. it's a lot to filter through.
Yes.
So I've brought some examples of some of my favorite products over here, but then wanted to point out as well something you can always look for. There's a group called the Veterinary Oral Health Council, and they are a group of board certified veterinary dentists,
Okay.
and they look at all these different products. And so if you go to the store, and I don't know if we can see this on here, but if you
there's a
look,
label.
there's a label on a lot of these products that says VOHC on it. And that is something that you can look for as a pet owner at the pet store. Look for that label on the bag. You know it's been tested and tried and certified, and so it can help you sort through a lot of those different products out there.
And you can see it right there on the corner of the bag, VOHC. I also know too, the anesthesia of going into a dental procedure, that can be concerning for some, but clearly you do this so often.
Yes.
And you're going to know how to manage that pet, and then you're also going to be taking in the pet's health into consideration to know what the best way to navigate their dental health would be.
Exactly, and that's something that you want to talk to your veterinarian about. But dental procedures on dogs, we're doing an average of about 3 to 4 a day sometimes in our hospital. It's a very common thing because it is one of the most common diseases and issues that our pets have. But you want to talk to your veterinarian. You want to make sure you're getting a good full assessment, doing your pre-anesthetic blood work to screen for underlying issues to make it as safe as possible.
Yes.
So there's a lot of different things we can do to really make sure that it's a healthy, safe procedure for them, but we're taking care of that underlying issue as well.
And it's really important too that they have good dental health, just like for ourselves too. I mean, it prevents other future diseases and make sure that they're eating the way they should be.
And they're really good at hiding pain, so it's painful for them if you've ever had a tooth issue.
And you don't want your pet to be in pain. Where do people go so they can reach you?
Our website, adaanimal.com, best place to go to get more information on all of this.
Dr. Norman, thank you so much. Thank you so much, Rocco. We love you. You're such a good dog. Okay, everyone, stick around. More to come right here on Ido Today, right after the break. He's waiting for more cookies because